I'm Toby, Commercial Sustainability Manager, and that means I get to help drive sustainability forward at Mölnlycke. Decarbonisation refers to the process of reducing carbon dioxide and other greenhouse gas emissions across operations, supply chains, and products to mitigate climate change. The healthcare sector is a significant contributor to global emissions. This is popularly estimated between 4 and 5% of total emissions worldwide, and that can cause a certain level of climate anxiety in healthcare professionals. I think we can benefit from some perspective. The defence industry is also estimated to cause 4 and 5% of total emissions, and private transport like cars to cause up to 7%. There are therefore other targets for decarbonisation, but healthcare decarbonisation is essential because the link between human health and climate has been made. Global temperature rises have led to extreme weather, flooding, and heat. Heat-related deaths climbed to over 47,000 people in Europe in recent years. We cannot have a healthcare industry that has a negative impact on human health. So we do need to change. In fact, we need transformation. Healthcare organisations can't decarbonise the whole world by acting alone. That's where SBTi, the Science Based Targets Initiative, comes in. It's a global framework that helps all industries set emissions reduction targets in line with climate science and the Paris Agreement goal of limiting warming to 1.5 degrees centigrade. SBTi validate an organisation's targets to ensure that they are both ambitious and achievable, and those are equally important. You can't keep fit and healthy by setting a target to go for a jog once a month. Nor can most people do a daily half marathon. So impossible targets don't help. SBTi ensure that an organisation is doing enough, but is also capable of delivering what it promises. Decarbonising using science-based targets can deliver benefits, such as lower energy costs, reduced risk exposure, and access to green financing. But you don't have to set your own science-based targets to benefit from them. When you purchase something, you are also responsible for the emissions involved in creating that product or service. According to the Greenhouse Gas Protocol, purchased goods or services form part of your Scope 3 emissions. So if you buy a medical device from a manufacturer with SBTi validated targets, you know that they're aiming for continual reduction to net zero by 2050. This means that some devices might become decarbonised in an acceptable timeframe. As a general trend, medical device manufacturers with science-based targets will reduce device emissions over time. But you need to measure the impact of each individual device, as some products may perform better than others. As an example, Mölnlycke's life cycle assessments of individual devices show that innovations like changing a draping material can reduce emissions by up to 27%. Other changes, like switching to renewable electricity at our manufacturing sites, have reduced the emissions footprint of some of our gloves by up to 22% between 2022 and 2024. It's worth remembering that life cycle assessments like these can make comparisons in this case before and after changes were made, because we own and understand every step in the manufacturing process. However, Mölnlycke cannot compare our product with another manufacturer's. The reason we can't is that we can't understand enough about another manufacturer to make that comparison. Nor will our methods and our assumptions align enough that we can compare our life cycle assessment with one from another manufacturer. Product-level comparisons might not be possible, but organisations can be compared. Organisations with science-based targets are more likely to reduce their emissions over time, more likely to report those emissions transparently. They're also more likely to invest in cleaner technologies, resource efficiency, and adaptation to prevent climate change from interrupting their operations. If you are in a healthcare organisation's procurement team, all of those things are really great news.